Hi, Kay. It's Alicia. I'm sending in my abdominal assessment for you. I am not doing it on a family member because I don't want to get too close to my parents right now because they're not working and I am. So we're kind of keep our distance. I have put on a belly button and a couple nipples. Becky told me that that's what she did, and I think that is a smart idea. So I'm going to use my elephant Miguel here. He's going to be my dummy for the assessment. So at first I would introduce myself. I would identify the patient. I would um, check the doctor's order, ask them their name, and check their ID badge just to make sure it's them. I would ask if they were comfortable, and then I would continue explaining the procedure and making sure they understand everything that I'm going to be doing, that I'm just going to be touching them and asking them the questions. And if I get their consent, then I would make sure the room is private so they have some privacy. I would start off by asking if they have any pain in their abdominal area. So I would use the OPQR-STU method with O being onset. So I'd ask them, when did the pain start? P, uh, I forget the exact word, but I know I would ask them what makes the pain better and what makes the pain worse. Meaning, like if running makes it worse and sleeping makes it better. Q would be the quality and quantity. So is it a dull or sharp pain? R, radiate, if it radiates anywhere at certain times, and what region is it in? S would be the severity, so on a scale of 1 to 10, with 1 being the best and 10 being the worst, what's the pain like? T is time, which is when when does the pain happen? So if it happens when they wake up, if it's at night, yeah. U would be their understanding, so ask them what they think it is, if they have any idea. And then I would ask them if they're on any medication, if they're allergic to anything, and then I would proceed to ask them questions. So I would ask them if they're having difficulty swallowing, if they are vomiting, or if they have diarrhea, if they're using drugs or alcohol or have in the past, if they have a history of the same pain before, or if their family has any history with this type of thing, or cancer or anything like that. I would ask them when their last bowel movement was and what it was like, if it was runny, if it was, um, like, I'd ask them to describe it. And then I would also ask maybe if they had any surgery in this area, so it could be a complication. After that, I would probably explain the vital signs, which would be the pulse, the blood pressure, their temperature, and their respirations. And for blood pressure, I'd make sure I do it when they're laying down, sitting up, and standing. And for their heart rate, I would check their apex pulse and their radial pulse. So I don't know if you can see exactly here where I would do everything, but I would start with the inspection. So I would look for, oh sorry, I wouldn't touch them yet. I would look for bloating, maybe some extension of the abdomen, the color of their skin, any hernias that are seen or noticeable, any scars at all, any marks or bruises, any hair around the area. I would also make sure that they're comfortable, and I would look at their facial expression. Maybe they're having some anxiety. Maybe you could see the pain in their face. After I would inspect, I would start with the auscultation. So I'd be, sorry, you can probably barely see me. Miguel is a very big patient. So I would be listening for vowel sounds and vascular sounds. So I would start in the right lower quadrant. Yes. I would be listening in all 4 quadrants, and I'm making sure I hear about 3 sounds in each quadrant to 30 per minute for all of them. So I would listen in the right lower quadrant, the right upper quadrant, the left upper quadrant, and then the left lower quadrant. So I'd be listening for bruits in each quadrant as well, and I would switch that to the bell. And then I would listen above the belly button, which is the aorta, and then to the left would be the renal artery. Listen there, hope that I don't hear anything. And then I would come down below their belly button, and I'd listen for the iliac artery. And slightly to the left again would be the femoral artery. And I don't hear any bruits. So everything seems to be okay. And then I would start percussion. So you don't want to do percussion or palpitation before you auscultate, because it can disrupt the bowel movement and put it into production, you know what I mean? So for percussion, I would be looking for the liver, which is in the right upper quadrant. So I would go across, and I'd find, so there we would find the end of the liver, so that's, we know where it starts, which is about normal. And then you would go up all the way until you got to the liver, and same with on this side. So you would know that the liver is there, it is not swollen or anything. When you get to the liver, it would sound dull. And then it also says something about percussing the kidneys, which you would do from the back, I'm pretty sure. I don't think we went over that much, but you percuss at the back with your fist and everything. So when you're percussing in the abdomen, you are looking for a tympanic noise, so it's all timpani, except for the right lower quadrant, you would find the appendix. The right upper quadrant would be the liver. The left upper quadrant would be the spleen and the stomach area. And then the left lower would be the descending colon area. So then to do the scratch test, you would put in your stethoscope and you would listen with the diaphragm just below the xiphoid process, and you would scratch and listen going up to the liver, and when it reaches the liver, the sounds will be more dominant, so the sound will change when you hit the liver. And then after that, everything's okay, I would start palpating. So palpitation, I would use 3 to 4 fingers, and I would go in, feeling for lumps and bumps and watching their facial expressions and seeing what their pain level is, making sure I release and I'm only pushing in about 1 centimeter. While I'm doing this, I would also be feeling for any moisture, the texture of their skin, some rashes, if there's tenderness at all. And yeah. And then after that, sorry, I don't mean to lay on my patient. He's okay. After that, I would just explain my findings to them and give them any recommendations, maybe tell them to go see their doctor. If there's an issue, I would explain what they think it is compared to what I think it is, and yeah, I would go from there. So I would tell them to follow up with their doctor and yeah, give them basic recommendations. Okay, thanks, Kay. Bye.